We're going to go ahead and get started. Tonight is Webinar Wednesday. Welcome. Thanks for joining us today. Our topic for this month is mood, and tonight's webinar will be what you need to know about MS, mood, and mental health. My name is Krista Sipp, and I'm Associate Director of Programs here at Can Do MS. Tonight, I will be your moderator. I would also like to thank our sponsors for supporting this year's webinar series. Thank you. And then I would like to draw attention to a few other programs that we have this month. So after tonight's webinar, we'll be following that up with a Jumpstart program next week. Tools to tackle anxiety, depression, and more MS mood challenges. Then we'll also have your questions answered, which is an open forum Q&A later this month. And then I would like to draw special attention to the last one there, which is a 4-part coaching series for support partners. So this program is geared specifically for support partners. With us, we have Lucille Carrier and Matthew Sacco, who are both psychologists. Welcome, Lucy and Matt. Thank you for joining us.
Thanks, Krista. I'd like to start off tonight and just say welcome to everybody, and thanks for joining our program. I'd like to start off with at least giving you a really brief outline of what you can expect for us to cover tonight. We're going to spend a little bit of time focusing on learning some of the basic facts about mood changes in MS. That's important because there are many myths, there are many misconceptions, and we want to make sure that we try to clarify some of that so you know what you're dealing with here. We're going to talk a little bit about how mood impacts wellness behaviors, communication, and ultimately our relationships. That's a lot packed into that learning objective, and you'll see as we go through that that it's a pretty important grouping of topics. And then lastly, we really want to make sure that we kind of wrap things up tonight by focusing a little bit on how members of the healthcare team might be able to assist with mood management and ensure that what we're doing is kind of pointing out and highlighting how a wide variety of your team can be helpful, and maybe in some ways people that you may not have thought of on the front end. So that will be ultimately where we will go tonight, and hopefully by the end of it you'll be able to feel like you've gotten some information under all of those.
Right. Thank you, Matt. And yes, great to see everyone tonight. I'm glad you all could join us. Let's kind of start talking a little bit about mood in MS, and specifically thinking about the understanding of these terms that we're going to use. Matt was mentioning kind of the impact of mood on us, on our relationships, on our wellness. And so let's kind of take a little deeper dive into understanding what is mood. We use that term and we throw it around a lot, but we think about somebody's mood as their emotional state at any kind of particular time. But we differentiate that from emotions. Emotions are often brief, they may be intense, and more often than not, they're triggered by something in our environment. And so we very kind of strongly feel that emotion. We gave the example here of we got maybe a good MRI result, feel a sense of relief, or contrast that to somebody cuts me off in traffic and I feel really angry, right, for a brief period of time, usually seconds or minutes. We contrast that with mood, which tend to be more longer lasting emotions. Emotions kind of over time is how we think about that. That can last from minutes, days, maybe even weeks. But this is kind of more informed by what's going on in our head. What are our thoughts? What are some of those emotions that are contributing? And how are we acting on those? And so those can be a little bit more of an interplay, but the two inform one another when we think about briefer emotions that we experience day to day, throughout the day, lots of different emotions from those moods, which tend to be a little more longer. This is all relevant as we think about mood changes, specifically in the setting of multiple sclerosis, which we know mood changes are incredibly common. Again, though, we want to think about how are we differentiating and classifying those emotions that we're feeling. Is this kind of, again, just kind of the normal emotions that anyone would be experiencing in the absence of MS? Or are these some kind of problematic emotions that are particularly bothersome or getting in the way of life or affecting quality of life that may require or warrant further evaluation? We also think about these mood symptoms in that category of the invisible symptoms. I'm sure most of you are very familiar with that term, invisible symptoms, those things that others are not seeing, that you're experiencing internally that certainly have a real impact on day-to-day life. Mood symptoms absolutely fall into that because we know they can be a symptom of multiple sclerosis, in addition to an adjustment or a reaction to what you may be experiencing as a result of MS. Unfortunately, mood changes when living with MS are vastly underreported. They're underdiagnosed, which also means they're undertreated. So this often may not come up in your doctor's visits, or maybe there's a reluctance to mention it. Maybe there's a stigma or an embarrassment that somehow I'm not coping well. And so those can oftentimes lead to that underreporting and lack of treatment. We want to specifically hone in tonight on depression and anxiety because we know that those are the two most common forms of mood disorders, anxiety disorders that one experiences when living with MS. And so we want to really highlight those two and some of those implications and what may be kind of some ways to work through those.
All right, so let's start talking about our understanding of anxiety and MS. And as Lucy suggested, we're focusing on anxiety and depression really because they're large umbrella terms that cover a lot of things, but it's not exclusive to MS. It's just anxiety and depression. There are a whole host of other things that can be going on as well. But to start with, we do know that research suggests that anxiety disorders are up to 3 times more common in MS than the general population. So certainly there are a lot of things that MS affects that can cause increases in anxiety, but more broadly, the longer standing experience of anxious symptoms is going on in MS more than the general population. It's a little more than nervousness, more than a day of feeling uneasy. This would be rising to the level where it interferes with your ability to get things done. And so we do know that obviously with multiple sclerosis being an inflammatory disease, that any of these issues that we start talking about that are going on internally are often driven by some sort of inflammatory process. So if the inflammation in our central nervous system is kind of increased, then it's almost like effectively turning up the temperature, if you will, on just about everything. So we often hear these things where people say they're not sure why they feel what they feel. They're not sure where this is coming from. And so there's certainly something to do with the neuroinflammation piece. But there's also all of the other components to anxiety, like the worry about how you're going to get things done, who's looking at me, what's changed, how am I going to do this? That cognitive component to anxiety, when you start to reflect on when MS is affected, also drives some of that up. And of course, to the point where we see 40% of people with MS experience some sort of anxiety. In addition to under that anxiety umbrella, also thinking about the number of times folks with multiple sclerosis have to do something like get an MRI, right? And getting in the MRI in and of itself can trigger quite extensive, anxious to the point of panic-like symptoms. And panic is a symptom as a type of anxiety. So most people outside of, in the general population are not getting repeated MRIs like that. So if you're a person who has difficulties with tight spaces, that kind of makes some sense. We talk about anxiety and its relationship with cognitive processing. Some of this you can really relate to when we think of that tip of the tongue phenomenon, where people are like, I can't come up with the right word. And the more you focus on it, the more you think about it. In some instances, it might be pretty benign. It may not mean anything. But if you're really struggling and you're beating yourself up and frustrated because you can't get that word, it's just going to drive it up more. And I often talk about this as it relates to, things that you're trying to remember or relying on skills that you might not necessarily rely on normally. Like, if you're going, let's say, to the grocery store, you're telling yourself you need to remember a list of things, and you walk into the grocery store and you immediately forget them, or you forget 2 or 3 of them, and that in and of itself has nothing to do with MS, right? So understanding that sometimes we set ourselves up to fail in some regards when the normal everyday average person wouldn't be able to remember that either, but yet the interpretation when you're going through this with MS is it must have something to do with that. Now, more directly, we know that anxiety does in fact exacerbate any kind of cognitive dysfunction, cognitive problem that is going on with MS. And in this fight or flight response, fight or flight often is described as kind of an anxious panic-like response, at least what we label it as, because it's that immediate response when something is threatening. And when that happens, the processes that we utilize in our brains for long-term memory retrieval, for any other kind of basic processing, it shuts off, because essentially the brain's saying, what good is this skill? I don't need this if I'm in fight or flight and potentially interpreting this as I'm going to be dead in 2 minutes, right? Unfortunately, we don't often get the cognitive piece doesn't catch up, or the thought piece doesn't catch up until after the damage has kind of already been done, so to speak. All right, and now on to depression. This is one of the most common symptoms of multiple sclerosis. And in fact, you read that correctly. It is a symptom of MS. So as a result, we know for sure that people with multiple sclerosis have a much higher incidence of depression than the general population. Again, similarly, might likely have some relation to the neuroinflammation. Medications, both depression and anxiety, are related to steroids. Some people have a very, very powerful anxious response to steroids. Some people can have a pretty powerful depressive response. Unless you've had the high dose steroids, like many folks who are going through a relapse have had, it's hard to describe what that feels like. It isn't necessarily related to the severity of the disease symptoms. So oftentimes depressive symptoms show up first. People don't necessarily realize that that's what's happening. And then in hindsight, you're able to kind of connect the dots, say, wow, I was kind of struggling a little bit before that. And obviously, we also said there are some other medications as well. Depression worsen pain. Pain makes depression worse. Depression makes cognition worse. If your cognition is slowing, you're going to feel more depressed, more fatigued. These can become quite vicious cycles. And they are not the same as just kind of having the blues. That is not the same as a clinical depression. We start talking about a clinical depression lasting much longer and often feeling more permanent. It's more pervasive, and it affects just about everything that you do. It is not just kind of having a bad day or two. And that's important to recognize, because that is where it starts to affect your functioning.
Another aspect to this, Matt, too, that I'm really seeing in the chat is for individuals who are living with anxiety or depression diagnosed prior to their diagnosis of MS. And so it brings into question maybe some of that diagnostic timeline of things, but can certainly complicate things, and maybe we see a worsening of the course potentially in the context of the disease. Or
yeah, that's a great point, because you start to have those symptoms, and the diagnosis, even if you're having other symptoms, the diagnosis of MS is really depending on the day you're in the office that they tell you that's what it is. That clearly people have experienced symptoms for years, so it's very, very likely that a lot of these depressive and anxious symptoms are related to that initiation of that disease process.
So you might be thinking, well, I've got anxiety and depression, but I also may be experiencing some other really problematic emotions in the context of MS. And so we also want to highlight that as it relates to irritability, to anger, which often are associated or symptoms of depression or anxiety. In addition, some of that sadness maybe even grief, right? Losing functioning in some areas, losing really important aspects of their life as it relates to the disease, as well as maybe just some health-related worries, right? And so again, we recognize that these emotions can really span across different types of aspects of your life, and you may be experiencing these in various times along the disease continuum, but it's important to recognize these, whether they're those distinct emotions that kind of happen day to day, or are these part of a bigger clinical picture, mood disorder or an anxiety disorder, for example, that we need to take a further look at. Now, when we think about kind of the next step, we've identified the emotion or we've identified the mood, what may be contributing to it? And as you can see, it's not a kind of simple picture. There's a multitude of different factors when you're living with a chronic neurological disease and living life that could be contributing to your mood as it relates to your physical health. How's your energy? How are you eating? As Matt mentioned, pain conditions, spasticity, of course, can trigger a mood for you. The medications that you're putting in your body, you may be on a number of different medications that all have mood-altering kind of elements to them. How are you sleeping? I don't know too many people that when sleep isn't going well, the rest of life isn't going so well. So that's another element too we want to think about, as well as the disease process, right? Your disease activity, and then your relationships, right? When we feel supported, when we feel secure in relationships, that often relates to more positive emotions as opposed to unhealthier ones where we may be more susceptible to mood changes, of course. So I think it's important for each of us to kind of recognize that particular mood we may be experiencing. What are my unique triggers? I may not be as affected because of what I eat, but maybe if I get off a couple nights with sleep, I really notice my anxiety start to increase. And so this is important, but really quite individualized.
Yeah, and also to recognize, because there are so many different factors that can contribute to mood, while that may on the surface appear pretty overwhelming and pretty daunting to think about all the different factors, another way to think about it is to be looking at all the different spots you have for intervention. Sometimes people get stuck in one path thinking, oh, I got to do this, that, or the other thing. And there can be a variety of places to start, and may lead to feeling a little bit more optimistic versus thinking that it's a much narrower path than it really is.
That's a great point.
So while I know that the topic here tonight wasn't specifically focusing on cognition, we have lots of other programming through Can Do and other places that talk about cognition more specifically. I thought it was really important to ensure that we do talk a little bit about it tonight as it relates to mood, because they are so highly related. And as you can see by these two kind of flow charts here, that the endpoints, one is, starts with cognitions and one starts with change with mood, are really driven by, the course of what can happen with MS. So if MS does in fact cause some sort of change in cognition, maybe makes processing speed more difficult, you can't keep up in conversations, you feel kind of foggy, makes it really difficult to want to put yourself in a position where you're out and about and socializing with people. So instead you withdraw, because social withdrawal is, it's not necessarily initially anything that you want to do, but it saves you from that taxing feeling that occurs when you're constantly feeling like you're behind the conversation. But after a while, that social withdrawal, for most people, because we are social creatures and it represents a change in how you were before, can start to feel increased symptoms of depression or anxiety. Certainly the anxiety then can kick back up with the thought of having to potentially go back out and meet people or to do things again, but just directly as a result of withdrawal. And then the other side of it, if your mood's kind of down, and as a result, if you're kind of feeling over the course of a few weeks or months or beyond, kind of again foggy and discouraged because you're really down, and again, it leads to more withdrawal and slow to worse cognition. We know that folks who have significant depression often have changes in cognition, MS or not. If we can extract MS from this, but we know depressed moods, seriously depressed mood, leads to slowing in cognitive processing. And then that has nothing to do with MS specifically. Now, of course, add MS to it, and the odds of that getting worse are much higher. But just note that these connections between mood and cognition exist normally for us. And then again, like I said, add disease activity, it's going to feel a lot worse.
So you might be thinking, well, how do I manage all of these moods and when are they becoming problematic? And I think it's an important piece for us to kind of stop and recognize that we all experience bad days with mood, right? Our moods are informative. Negative emotions can be kind of vital to our survival, our well-being, and our kind of pursuit of building resilience. They help kind of alert us to dangers in our environment and really help us listen to kind of our internal state. And so it's normal to have those days where we're feeling a little bit more down, or we're bothered by something, or feeling frustrated or worried. Where it becomes problematic, though, is when it's lasting a little longer, when it's getting in the way of taking care of yourself, when it's disrupting relationships, when we feel like we just can't kind of get through it, like we feel like we're kind of in a funk, for example. Those might be kind of some indicators for you as you're listening to kind of be on alert of kind of starting that kind of process of evaluation and kind of learning what your options might be in terms of treatment.
It is not hard to imagine how our mood can affect our relationships, right? We're kind of programmed to understand this from as long as we're old enough to recognize mood changes in anybody around us. So that's not the novel part of this, right? Where we start to talk about this more specifically as it relates to MS is knowing that there are often more challenges with mood. Obviously, we already saw the numbers with depression and anxiety. And sometimes because of the lack of understanding and knowledge of what's going on, it can increase the frustration both with the communication with the people around us. So of course, like family, and whether it's, a husband, a wife, a partner, being a little just from being a little more irritable to feeling really, really down and depressed to the point where it is often physically almost feeling impossible to get out of bed in the morning, outside of, whatever other symptoms of MS someone might be experiencing, whether it's spasticity and things like that. But just feeling like you're unplugged, like there's just no motivation to do anything. And whether it's missing, kids' activities or family parties, or, it usually starts with, friends wanting to go out and you say, well, I'm not really feeling it today. They ask you again, I'm not feeling it today. Eventually, they stop asking. And then we turn inward and start to question, well, why does no one want to go do anything anymore? And that further perpetuates this downward spiral. And of course, other social relationships as well. When we're not feeling up to it, not just kind of, I'm just, like Lucy had said, it's not just a bad day, right? But when it feels like you're completely drained, you have no other energy, nothing else to give, and you're feeling that down, there is no real good way to kind of engage in that fake it till you make it kind of thing. That doesn't work real well. Because I know many people have tried that, and many people do a lot of that. I'm not saying that doesn't work in some instances, but it is not a long-term strategy when you're dealing with a really depressed down mood. Communicating that, besides potentially people seeing how you're carrying yourself, it doesn't always go over well, but how many times people ask, well, what's wrong with you? why are you so whatever? Like somebody asking that can actually in and of itself trigger irritability, right? Well, what do you mean what's wrong with me? Why there's always something wrong with me? And it just turns into this unnecessary, contentious friction, because often it results as a lack of being able to communicate more effectively what the mood is, because it is invisible for the most part to other people. And, it does begin with good communication skills. The good news on that is that we have programming around through Can-Do relationships and communication that can go into a great level of detail on strategies, tips, things like that might be really helpful. Because we know that the mood can increase, like I said, conflict, irritability, frustration, and oftentimes it may not really be what the topic of the argument or discussion even becomes about, right? It ends up we arguing and have conflict about other things, and it can be really hard without effective communication to be able to articulate maybe really what is going on.
All right. So how do we start the process of kind of communicating what those needs may be? And certainly this is starting with, well, what are the needs? And I think this is something to kind of think about individually, since this varies from person to person, mood to mood. But kind of thinking about, if you're feeling particularly anxious or you've been feeling down or sad, and you're maybe starting that process of kind of reaching out, maybe thinking about those people closest in your life, the ones that see you day to day. We often think about those support partners in our life, and kind of reaching out and considering what is it that would be beneficial? What is it that's going to help you in that moment and give you kind of that step up? Is it simply that you're looking for motivation, support, kind of a cheerleader, like a general sense of kind of added support to your life? Maybe it's been a little harder to kind of get out of bed lately, or you're just not feeling like you want to go attend some of those, I don't know, activities or family events that you used to kind of previously enjoy. Maybe you just need a little more motivation. Conversely, maybe you're feeling particularly anxious and really worried, and it's hard to get your thoughts together. And maybe you need someone to kind of sit down with you and maybe plan some things out. Maybe help kind of organize things a little bit more. And so that's where we may see that some of those needs that you're trying to communicate get a little bit more specific. And, if Matt and I know anything about working with those living with MS and their support partners, is we know our support partners, you don't have a crystal ball. And so it's hard for those partners to kind of know specifically where you may be leaning. Is it more that general support, just listen to me? Or are you wanting them to kind of put on their problem-solving hat and really kind of help with some very specific things? And the more opportunities we can give them of where to step in and how to step in and intervene, I think the better that interaction may be, and maybe meeting some of those needs. So when you think about kind of that approach, we want to make the time for it. And I really like this piece here that we included of, can we do it when there's not a crisis going on? We don't want to be driving the bus and writing the map at the same time. Can we maybe lay the groundwork ahead of time and kind of create an environment where both parties are able to kind of sit down and have a discussion and we're not feeling distracted. Also, too, as we think about managing moods and helping partners feel more engaged in kind of the journey of MS, we also want to think, can they join appointments? Does it make sense? Does that feel right for you and your partner? Are there educational materials that can also help them better understand some of the mood changes, the medications that maybe have been recommended, as well as maybe your readiness for medications, like having them kind of part of that process as it feels comfortable, of course. In addition, support groups can also be a powerful place to help support partners kind of explore the process of mood and the changes of mood, I should say, and what some of those resources may be. Can-Do also has just a wide array of different support partner programming and across the different kind of topics that may also be relevant and helpful for partners in kind of understanding that journey. So the individual living with MS feels less of that pressure and burden to have to explain what they may be going through. Let some of these other programs and other resources do some of that groundwork for you. Also, too, thinking about kids, thinking about children, adolescents that may be in your life that maybe would benefit from understanding what you may be going through as a parent, for example. And we really want to think, how can we adjust that information so that it's age appropriate, that it's developmentally appropriate? And again, trying to be as kind of on top and proactive as you can. They're likely noticing these changes. And so how can you maybe get ahead of that and put it into words and phrases that make sense for them?
Lucy, I like your bus and writing a map analogy. One that I also often use, and folks who have heard me kind of talk about this stuff before, this will be familiar, but it's similar to, I often describe the fire escape that's on the back of the doors in the hotels, right? They draw those up, they put them on the doors when the hotel isn't occupied, when there's nothing going on. They can clearly map out how to get out in an emergency, because we would all suggest, well, no, trying to get out of the building and draw the map to get out in the middle of the fire is a dumb idea, right? We would acknowledge that, but it's the same thing. It's trying to make sure that you draw up your map when you're in a space to think clearly and not be reactive, and figuring out what your needs are during that time. Taking the emotion out of those conversations, the negative emotion out of those conversations, can be really, really helpful.
We've started kind of thinking about those closest to us, those support partners, maybe even family members, but these mood changes may also be experiencing other relationships that Matt referenced earlier. Thinking about friends, for example, your peer group. Maybe they're noticing some changes, or maybe you've been less reluctant to take them up on offers to kind of engage in social activities, go out for lunch or meet for coffee. And so we also want to be mindful of that in those relationships, because they do play kind of a pivotal role. With friends, we may be less reluctant to kind of share everything that we may be with our kind of closest support partners, our partners and spouses, for example. But kind of the general guidance we like to think is need to know basis, right? What makes sense in that moment? Do they need to know all the way down to your most recent MRI results? Likely not. Do they need to know kind of all the medications you're on? No, but if it feels comfortable, if it makes sense, then certainly that's a kind of a decision point to make. But I think, again, letting those friends know, those peers, what is it that you would be, that you would benefit from the most? Give them specific things if it's something that you're really needing of what would be helpful for you in that relationship. Work is another area too, when we think about how your career may be affected by mood changes. Again, these symptoms of MS are real, they're significant. And so we've got some links there in terms of kind of how to approach the disclosure process, which can certainly be highly individualized depending on your journey with MS, as well as your workplace, as well as your states. They all have different laws that are applicable, as well as federal rights. So we encourage you to kind of think through, investigate some of those links as well, as they're helpful.
So, not that one slide is enough to kind of cover when we start talking about the impact of mood on wellness behaviors. We probably could go into a lengthy discussion about this, but wanted to pick out some of the more common things. And it may seem for many of you like this is common sense, where we ask, well, how does MS affect your appetite or your diet choices, right? Well, I'm sorry, how does mood affect them? So, well, of course, if you're, first and foremost, if you're struggling and you just don't feel like doing stuff, you don't feel like preparing food or doing things the way that you used to, the odds of making what might be perceived to be unhealthy diet choices goes up. Right. So, it's the quicker. So I'm just going to do this. I'm just going to do that. And, whether it's McDonald's, whether it's ordering a pizza, whatever, where it's easier, it's more convenient, and because you just don't feel like doing anything. Not that those things are in and of themselves indicators that someone is having trouble with their mood. It just becomes when that pattern exists where people continually make and repeated unhealthy choices because they're struggling, or what people often will describe as mindless eating, right? Or anxious eating, emotional eating, where the eating and the consumption of food, at least initially, helps to make people feel better. And then, of course, afterwards, there are often a whole host of other emotions that people experience. So if you're struggling with your mood, you don't feel like doing as much, right? And so your activity level may go down, or you may be really restless and kind of fidgety and that kind of stuff. It's important to recognize that, in certain instances, we know that exercise can be helpful for improving mood. Obviously, exercise is helpful for a lot of things, but ensuring that what you're doing is working with your physical therapist or whoever is helping you navigate this journey with MS, so that you're able to engage in exercises that are safe and that are, of course, are effective for you. But we know that mood and anxiety affect so much of our decision making, and this is just one slide that kind of outlines some of those things.
So when do we know to reach out? We've been talking the last bit of the presentation about kind of identifying those emotions, understanding how they're affecting those around you, and kind of those important roles that you may have. And now we'd like to talk a little bit about, well, when might I start to reach out? When has this become chronic enough, or it's impairing enough, or it's interfering enough that now maybe I need to really have that conversation with one of my medical providers? So we often think about that self-monitoring process, really kind of asking yourself, what is it that I've been going through? How long has it been lasting? Of course, the intensity, and where is it really getting in the way? It's really interfering with my relationships. I'm having a hard time focusing at work. I'm not following up on those recommendations from my physical therapist, occupational therapist, as I should be, and I'm just kind of beating myself up over it. Those are good indicators as you're kind of taking note of those things, bringing those up with your provider, whether it's at a routine screening through your primary care provider, or you've got that 6-month follow-up with your neurologist. We want you to bring that up, as well as thinking, maybe I just saw my doctor and, gosh, I didn't say something. And now I think it's warranting me to reach out. Maybe I need to set up a separate visit, just so that I can have that conversation and share those important changes. We also want to think about, as I mentioned, if it's chronic enough, it's interfering, but we also too want to elevate if we're starting to feel suicidal, if we're starting to have thoughts of self-harm. I don't think I find life to be worthy. Those are all red flags, and those we need to bring immediately to the attention of a provider. Reach out, call the office, because that's not something we want you to live with. That's not something that's normal, and that's a sign of more severe forms of depression that certainly need immediate attention.
So this one slide is a really good reference slide moving forward for you to be able to look at managing emotions when we talk about through the course of this, the different emotions and what you can do about it, along a continuum from things that are really well within your ability, your own unique control, like changing certain habits, like exercising, sleep, your diet. Those are all ways that you can engage in healthy habits that improve or help manage your mood. Engaging in hobbies, and sometimes people say, well, I don't really do those. I don't really do anything anymore, or I don't spend time. So sometimes the best way to ask that question is maybe more about what have you liked to do? Like, what have you done in the past that you found enjoyable? What did you used to like to do? And if there are some of those things that still fit, it's really a matter of getting back to doing some of those things, even if it has to be a little bit differently than you did them before. So those are on the end of just the habits thing. So other things might be more focused when we talk about these kind of things you can do at home. Reading very specific books that may relate to maybe they're inspirational, maybe they're some self-help books. There are all sorts of things that might be useful to consume information that would help with that. There are a ton of different apps for relaxation, for meditation, mental health apps and websites. And there are all sorts of ways that you can get connected to information that doesn't rely necessarily on or require you to put yourself in front of someone face to face. So this is kind of the stuff that you might be able to undertake a little bit on your own. There are support groups, and with the virtual peer support groups, with COVID changed a lot of stuff. Some of it was really helpful in some regards to how we approach the virtual world. A lot of the folks with MS, you were engaging in a lot of this virtual work because of mobility issues and things like that before. In some ways, the rest of the world was forced to kind of do things the way that you were already doing a lot of this stuff. So those are still out there. There's online education. You don't have to leave your house, for a lot of that stuff. And then we work towards more directly interventional stuff that requires the input of what we might consider the professional support. So your primary care provider, that's your neurologist. We would encourage you to have both a primary care provider and a neurologist if you can. Psychologist, a mental health worker, therapist, those folks who can be a little bit more direct and very targeted, specific with your help, but it does require another person. Therapist-led support groups, different than those other peer-led support groups. Some of those groups that we often refer to as either support or process groups, where it is a little bit more. It's run by professionals, so there's a little bit more than just support that you're getting out of it. Or psychiatry. Psychiatrist is a person who specializes in pharmacology or medications for things like depression or anxiety or mood. Certainly PCP or somebody like that is able to be helpful in that regard as well. Sometimes though, when primary care providers may not necessarily be comfortable managing a more complex medication regimen, especially as it relates to managing that with some of the medications that you might be taking for your MS. It does complicate the picture with some other medications. So having someone whose expertise is in that world might be necessary if it gets too complicated.
And I would say, Matt, for that third kind of bucket there with the professional support, that's probably where we see the most individualization and tailoring, right, to an individual's kind of unique presentation, kind of hopefully, ideally in a state where they're understanding your MS, they understand the disease-modifying therapy treatment that you may be on or not on, as well as any other kind of pain conditions, for example, medical conditions that just kind of complicate the picture. I know there's been a lot of movement in the chat about just medications. How do I approach this? What medications are best for me? And that's really where that prescriber is taking in all of that information about you, understanding your medical and your psychiatric history. As many of you have mentioned, maybe you've had anxiety, depression for most of your life. And so that's something that they would take into consideration of kind of what's going to be the best regimen or combination for you, or maybe it's just simply to get options. Oftentimes it may just be a conversation that you're having. And so again, those are going to be really helpful. So. All right. So as we have been talking, Matt and I have of, talking with your provider, starting the conversation, talking with those support partners, we really want you all to kind of consider who's on your care team. Who is it that's in your circle that you can kind of turn to? Because as we mentioned at the very beginning of the presentation, lots of things contribute to mood. There's lots of room for intervention. Same thing too. Each of these different specialties and people in your life are going to have unique contributions that can help to improve mood based on their own expertise and discipline. So I really want you to think about this and what your team and circle look like.
And it's also really important between that slide and the one before to at least understand that the more people you have involved in this, or the more areas of your life that it's not a metric or a measure for how bad things are for you. So sometimes people think like, oh my gosh, I must be really struggling if I have a psychologist and my neurologist and my PT. Everybody's working on this. This is more about divvying up and finding a wide range of ways to be helpful to help with mood and anxiety, because the more options you have, the more people you've got giving you tips and tricks, the more likely you're going to be able to develop skills to deal with this in the long run on your own without, feeling like you get completely overwhelmed by it.
All right, and as we are wrapping up our presentation today, we really want you to think in terms of communicating this to those closest to you, those on your medical care team. Really proactive, clear, precise communication is key. Being able to kind of share exactly what it is you may be going through, ideally, and if not, really bringing the conversation forward. Something's not feeling right. And that's where that skilled clinician, hopefully, is sitting down with you and really trying to understand and discern that depression. Where's it coming from? What's contributing? Is this looking more like it's disease related or another medical condition? Or is this kind of a free kind of outstanding depressive disorder? Some of that can be hard to discern. And so really kind of sitting with a clinician to help understand that is going to be key. We also too want you to reach out to those providers, even when things are going well. Maintain those relationships. Keep up with your preventative care and your routine screening. Sometimes that can catch things that perhaps you may be thinking this is just temporary, or this really isn't that bothersome, but really kind of staying on top of that. Partner observations can also be really critical. Other care team members listening to what they may have to say. But we want you to know these symptoms are not imagined. They're very treatable. And in fact, they're some of the most treatable symptoms of MS, and thinking about your anxiety and depression.
Okay, thank you, Matt and Lucy. Really appreciate it. I do want to remind everyone before we jump into Q&A, at the very end of this webinar, we will ask you to complete a survey. So please hang on for us. But again, first, we're going to get some questions answered. We had a wide variety of questions in the Q&A box tonight. If we don't get to your question, feel free to jump onto our website to the Contact Us portion. You have the option to submit a question there too if we do not get to your question tonight. One question that a handful of people asked, one, are there mental health professionals specifically that specialize in MS? And two, how might you find one of those?
Yeah, absolutely. There certainly are mental health providers that do specialize, I think, broadly speaking, in chronic illness, and then more specifically in the understanding of multiple sclerosis and that interface between the physical and the emotional health. So yeah, they're out there. Unfortunately, there aren't as many as we would like to see. As Matt and I both are MS psychologists by training and in practice. There's general kind of search engines that you can look at for therapists. Psychology Today is probably one of the most common ones that I can think of, where you can search for providers who do at least have a background in chronic illness. And that can often be a really great place to start and kind of springboarding into understanding their unique kind of training background and clinical practice.
You can also utilize the National MS Society, MS Navigator, to get some lists of people potentially who are in the area where you live, who have themselves either worked with the MS Society to indicate that they are a specialist or they have an experience in that. So those MS Navigators can be really helpful locating that information for you as well.
Awesome. Thank you for those tips. As far as meditation, mindfulness, yoga, accessible yoga, can those be supportive of mood imbalances for, say, anxiety and depression and some of these other things that we've talked about? Are those things you can look to help?
Yeah, I mean, I think that the way I would kind of tackle that question is that, as Lucy had said before, about so much of treating MS is an individualized plan, an individualized approach. What works for one person may not work for another. So if you're doing something that is largely considered healthy, like whether it's meditation, yoga, obviously adaptive yoga, chair yoga, whatever it is, if you're doing something and engaged in an activity that is healthy and you end up feeling better, whether it's less depressed over time, less anxious, whatever it is, I would say, yeah, it absolutely is a very effective tool to help you manage anxiety and depression. It's just different for everybody. And it can be very, very different. Some people don't like and can't necessarily feel relaxed by doing meditation, right? They may need something a little bit different. So if it works for you and it's relatively healthy, yeah, I would say, yeah.
Awesome, thanks, Matt. One other question that a few people asked in a handful of different ways. So sensory overload, brain chatter, things like this. How does that relate to mood and MS? And what can be done about it?
The cognitive changes with MS can be challenging. They are often, as Matt mentioned earlier in the presentation, commonly defined by a slowing in your thinking. They may also affect your ability to organize, to plan, which can be highly frustrating, right? As you're kind of navigating life and trying to explain things to those in your closest to you. So they can be really quite impairing. And then you throw into that, if you're already struggling with changes in mood or feeling anxious or worried, it's just quite a storm then that you're having to kind of navigate. And anxiety, I often like to say, in and of itself is disorganizing. And then you throw in some of those subtle changes that you may be experiencing when living with some thinking changes of MS, and you've got a real challenge on your hands. And so the two absolutely will kind of feed into one another. And so what we like to do is think, okay, how can we start to manage the mood component? What are some things that can help with maybe reducing my anxiety, reducing symptoms of depression or sadness, as well as some of those thinking changes? Do we need to get those evaluated? Do we need to talk to the doctor? How much of that relates to changes in mood versus some of the changes related to MS? It can be complex to kind of figure some of that out. Having a provider kind of start to look at that a little bit further, I think can help with normalizing it, understanding your unique journey. Everyone's is a little bit different, but the two can be hard to disentangle.
It also speaks to why we said before about having so many different professionals on your team, because all of those could potentially be issues that are assessed and treated by a variety of specialties. So sometimes, occupational therapists who specialize in cognitive rehab can be really helpful in organizing an environment that triggers less of that distress, whether it's being overwhelmed, that sensory overload. So you may have to set your environment up better than it is now. So the more different professionals to look at it from different standpoints can be helpful, because it isn't simply a matter of, oftentimes it's not simply a matter of just treating one thing. There are other factors that go in, and with MS, we know that people are often more vulnerable to some of those sensory overload things as well.
Awesome. We have a handful of support partners out there tonight, so thank you for joining us as well, and had a couple of questions. So I want to give space for those questions to be answered as well. I'll kind of give you both of them right off the bat and you can address those. But the first one was, how can I help my person with MS when mood swings occur? And then the next one is suggestions on how to encourage a reluctant MS partner to seek counseling for depression.
Well, I can certainly address the first one, which is how to help them when they're with the emotion overwhelmed or the mood swings, and go back to one of the points that was made earlier in the talk tonight, which is the best thing you can do is not wait until that happens to try to address it. Right? If you're trying to figure out in the midst of those mood swings what to do and how to deal with it's not going to be very effective. It really isn't. That's where having those conversations when things are a little bit better, maybe when you're both at your peak, and it can actually throw some energy at this conversation. And it may be something where you do some brainstorming, whether it's together, whether it's with a professional. I don't know. You'd have to determine your individual kind of situation, but it may just start with asking that person, what is it that I could do that would be helpful to you when this is happening? And that kind of open dialogue, there may not be a specific answer, but it can open that dialogue to listening, to hearing the big picture. And if it's something that does require or may need some more professional intervention, you can go from there. But do it when you're able to have a conversation and not be in the heat of the moment.
Really smart. Any suggestions on kind of talking to a reluctant partner about seeking counseling?
I'll give you that one, Lucy.
That can be a tough one. I will say that. I think it's bringing the concerns to them. Here's how I'm seeing it's affecting you. But I think it's all in the approach. I think that is kind of where it's going to be better received if it's coming from a place of concern, and how it's affecting perhaps the relationship or other areas that are important in life, and where it's getting in the way.
You could also not so subtly leave links to the can-do programming in their inbox or whatever, because that is one way to do it in a pretty non-threatening way, which is to be exposed to information like this. Pretty passive. You don't have to actually actively engage, but to hear and know that other people are dealing with this may help open that door. We also have the support partner coaching series that could be helpful as well. Sometimes it's just that fear because you're feeling like you're in it by yourself, and it can be alleviated a little bit by hearing that other people go through it.
Wonderful. Well, thank you both for answering all of those questions. I know we did not get to everyone's question tonight. So again, please submit your questions on the contact us portion of our website. And while tonight's webinar may be over, you can connect with us in a variety of different ways. And next month, we have our bowel and bladder as our topic. So how to beat your bowel and bladder blues is our June webinar. That'll take place on Wednesday, of course, webinar Wednesday, June 7th. I do want to draw attention to a special program that we're doing this year. So this year at the CMSC annual meeting, we will be hosting the More About MS program, taking charge of your MS care. That'll be on Friday, June 2nd. We're offering this program both in person in Colorado, where the meeting will be held in person, and virtually. So check that out, register today. It's a unique opportunity to be involved in CMSC, whether you are there in person or remotely. We'd love to have you join us. One more time, I'd love to thank our sponsors tonight. Thank you so much for joining us. We really appreciate you being here. And again, thank you, Matt and Lucy, for sharing all your knowledge with us on tonight's webinar. Have a great night, everyone.